My name's Ami Banerjee. I am Chief Investigator of the STIMULATE-ICP study, which includes a trial in people with long COVID. Today, we are going to be talking about the trial design and what it involves if you are a study participant. So first of all, we're going to go around and meet the people involved. So Emma, you first.
Hi everybody, I'm Dr. Emma Wall. I'm an infectious diseases consultant at University College Hospital, and I work in the University College Hospital London long COVID clinic, and I'm the lead for the drug trial nested within STIMULATE-ICP.
Thank you, Emma. If we go to Denise next.
Hi everybody, my name is Denise Forshaw. I'm based at Lancashire Clinical Trials Unit and I'm the Principal Trial Manager for STIMULATE.
Thank you, Denise. Then Kim.
Hi, I'm Kim and I have long COVID and I'm one of the PPI, that's Patient and Public Involvement group on the STIMULATE-ICP study.
So I'm going to hand over to Kim, first of all, to talk to Denise about the trial design.
Thanks, Amy. So, Denise, what can you tell us about the trial? What's it involve? If you're a patient, what's going to happen if you take part in this trial?
Okay, so in simple terms, STIMULATE is effectively almost two trials in one. So we know that long COVID clinics developed at a fast pace to deal with what is in essence a new illness. So that meant that not all clinics are the same or deliver the same care. So we want to look at what usual long COVID clinic care looks like across the different types of clinics. And that's why we've chosen clinics in different areas, using different care pathways, sometimes different staff and different access to services. And we want to unpick what all that care looks like and what aspects of care seem best able to benefit most patients. So we'll also test an integrated care pathway to compare with usual care. And an integrated care pathway simply means we'll introduce a more structured, multidisciplinary or joined up approach that's specific for our long COVID patients, tailored to them. So as part of this integrated care, we'll be evaluating the use of cover scan. And this is an MRI that scans all the major organs affected by COVID in one go, whereas currently scans may only be done for the organ that seems to be most affected by COVID, with very little known about other organs. And we'll also evaluate a new community-based rehabilitation app called Living with COVID Recovery. And the app content will be tailored to patient needs after an assessment. And this will be supported by clinic staff, reported back to the whole team to inform patient care. It's interactive and will send updates that patients fill in on their progress, and they can ask questions within the app as well. So obviously, to be able to compare what works best and what may not, we need to compare usual care against the integrated care pathway. So in this study, all patients will get all usual care they would normally, and some will receive an integrated care pathway addition. And this is the only way for us to be able to see if things are useful or not.
Okay, so obviously everyone's going to want the cover scan MRI. I mean, it was something that I participated back in when it was a very early pilot trial, and it was really, really helpful to get that MRI of all my organs done. So how is it going to be fair, and who's going to be decided? Who gets the scan, who gets to go on that integrated care pathway? How's that going to work?
Yeah, you're right. It's really important that we are fair and all patients have access. So we've used a computer program to decide this, and we've built the program to make sure that every person in every single clinic has an equal chance of being in any group. And we've also made sure that every patient has the same opportunities, whether they decide to join the study or not. So joining the study is completely independent of the care you receive at your clinic. So we're also offering the opportunity to take part in a drug study that will look at the effect of our chosen drugs in combination with the different options of clinic care. And we hope to use the combined data not only to better understand treatment options for long COVID patients, but also to inform the design of clinic services. And lastly, we're asking patients to gift a blood sample for developing a biobank of long COVID bloods. And these will be used to better understand maybe perhaps what predisposes some people to developing long COVID and the best ways to treat it. Or if we can identify that, we can be more proactive when people first become infected, or better protect those more at risk.
Oh, wow. Thank you. And I mean, obviously, people who've been unwell for a very long time are absolutely dying to take part in trials and you know, get involved and give their blood to you, and you know, would quite happily give you all of it, I'm sure. But who's actually able to take part in this study?
It is difficult, but as I mentioned earlier, we need to be able to compare before and after. So wherever possible, everyone should have the same starting point. However, in long COVID, we have a lot of variation within our patient group. So we have gender, length of time since COVID, and a huge variety in the severity and type of symptoms. We also have patients who were previously hospitalised with long COVID, and those who previously received clinic care. Having already received treatment means, in effect, your starting point is different from our usual long COVID patient, as we cannot determine the effects of different previous treatments on where your progress is now, and any long-lasting effects of any medications you've already received. And this could mean that you may show less benefit to these interventions and therefore make the results less robust. It would also mean we would have to recruit a much larger number of patients to account for all this variety and take much, much longer to answer the question. But I think everyone should be assured that any results rising from the study will inform ongoing treatment for all long COVID patients. So we're only recruiting long COVID patients who have not previously been hospitalised for COVID, nor have already been through clinic. So we will only recruit from new referrals who have not previously been hospitalised. We welcome all patients participating for data collection and blood gifting. And if you wish to take part in the drug study, then we will have to check that you're able to take any of the drugs you might be randomised to, that you're not on any medications that cannot be taken at the same time, and you do not have any health issues that would exclude you, and that you're not pregnant or intend to become pregnant during the course of the study. So if you're offered the opportunity to take part, you'll be able to discuss all these issues with the team. A clinician will review all your data and then decide if you're able to take part or not. If you cannot take part in the drug study, please consider taking part in the other parts of the study, the data collection and the bloods. It is very important, and we need all our patients to help.
Wow, thanks, Denise. And yeah, I completely agree that anyone who can sign up and get selected, it would be brilliant to have 100% participation rate, because it's going to help us get that data much faster and help everyone going forward. So thanks for explaining that. No
problem. Fingers crossed, Kim.
All fingers crossed, and toes.
Okay, thank you, Kim and Denise. In a separate video, we'll be talking about other aspects of the trial, namely the drugs and how those drugs were chosen. Thank you.